Welcome everybody to today's webinar on caregiving hosted by the Greater Philadelphia Business Coalition on Health. We are recording today's session and the recording will be available afterwards. If you are not a GPBCH member, you are welcome to just reach out to us to request a copy of today's recording or materials. Eric, next slide, please. So I'm Neil Goldfarb. I am president of the Greater Philadelphia Business Coalition on Health. I know we have several guests with us today, so I'll just mention GPBCH is the employer coalition for Southeastern Pennsylvania, Southern New Jersey, and Delaware. And our 51 members represent around 1.6 million covered lives. We have two guest speakers with us today. You'll be hearing from John Schall, Caregiver Action Network, in a little while, and Gina Murdoch from the Multiple Sclerosis Association of America. MSAA is a national organization that happens to be based in South New Jersey, and so we're proud to call MSAA one of our employer members as well at the coalition. Next slide. So here's the agenda for the next hour. We're going to be talking about the impact of caregiving on the workforce and how to identify and address the needs of the workforce, the impact of caregiving on your organization. We are going to ask you to use the chat box to post any questions. And as time allows, after the formal presentations, I will moderate Q&A. And also our speakers reserve the right to add comments and respond to questions in the chat box. Today's webinar is being sponsored by Bristol Myers Squibb, BMS, and so we appreciate their support. BMS is an affiliate member of our coalition. We also want to thank Spark Healthcare, whom we've worked with to plan today's event. And I'd like to thank Eric Croft, GPBCH's Director of Operations, who's handled all our logistics for today. So we're going to kick it off with Gina talking about the impact of caregiving on the workforce. I'll just say, as an employer coalition, we thought this was a great time to bring you a webinar on caregiving. We know that caregiving has been an important topic for employers in its own right, but we also know that mental health has risen to the fore as a major issue for employers, and caregiving is certainly a source of stress. And we also know that people have been very concerned about the impact of COVID on mental health and on caregiving. So it's a very timely topic, and it's great that we were able to get these two national speakers to join us today. So Gina, let's kick it off with you giving us an overview of the impact of caregiving.
Certainly. Thank you so much, Neil. Pleasure to be with everyone today. And I think Neil really kind of encapsulated it. As the country continues to age and as we're dealing with the pandemic, certainly support for caregivers will only become more and more important to employers. It certainly has become more important to employees, over especially being exacerbated with the COVID-19 pandemic over the last 2-3 years. Feels like forever, but certainly to employers, it's an important area. So Queen next, Eric. So I think this one slide really exemplifies the increase of caregivers. If we look at this report from 2015 to 2020, the amount of caregivers rose from 43 million to 53 million, so 18% to 21%. So that translates to 1 in 5 adults who has provided care to an adult child or child over the last 12 months. So that 1 in 5 number, when we're looking at your workforce, can have a significant impact on the future of the organization. So think about 20% of your workforce being impacted in what can be a second full-time job as a caregiver, and what that compounding impact can have on the productivity of their work as a caregiver, as an employee, and really what that can, how that can change your business. Also, I thought that the report was really interesting that a number of the caregivers, the care recipients, are dealing with more than one comorbidity. So it might be that the complexity of the care situation is growing, and how does that translate into the impact on the caregiving employee? Next. So using multiple sclerosis just as an example, wanted to talk about an example of a chronic disease. For those who are not familiar, MS is a disease of the central nervous system. Women are 3 times more likely to develop MS than men. It is a heterogeneous disease, so it really does not exhibit in one individual the same as it does in another. And MS is most often diagnosed between the ages of 20 and 50, both when the individual living with the disease and the caregiver really need to be at the top level of their productivity in their careers and for their families. So wanted to kind of bring this forward just as one particular idea and one example of a caregiving situation that may impact your workforce. So next. Wonderful. So I thought this was really interesting in drilling down on what the profile of a caregiver was. And this is for the Caregiving in the US report. This information is from that. And looking at the average age being 49. And 49 certainly, it doesn't feel old to me. So a lot of time and productivity that an individual is expecting and the employer is expecting from that individual going forward. So that is when this particular, when a caregiving is most often occurring. I think it's also interesting, 61% are employed. If we go back to the previous slide and look at 53 million were identified, we don't need to go back, but just kind of thinking back to the previous slide with the 53 million number, you're talking over 30 million who are identifying as caregivers and are also employees. So certainly that is a big impact on the workforce. And 34% question, looking at disclosure and the comfort around that disclosure. More likely people are to disclose if it's a high intensity care situation as opposed to low intensity situation, according to the report, and more likely to disclose if it's a higher wage earner. So certainly the importance of creating an inclusive environment for an employer to find out and how they can help their employees, certainly that is an important part that we want to focus on. Another point to note is that like MS and a lot of other diseases or care situations, they might change over time. So the intensity of the care situation that the employee is dealing with in the beginning of a situation in year 1, year 3, year 4 may very well be very different than the caregiving situation and what they would need from an employer later on down the line. So really that flexibility and how do you handle that from an employee perspective and employer perspective when the caregiving needs of your employees are not static, and it's certainly something to think about. Next slide. So also this is important as far as talking about the financial strain. So if we look at 45% report a financial strain for one category and 34% in more than 2. So when we're looking at this, that is an incredible amount of strain on their employees. And if we want to put it in real dollars and cents, again, spending an average of $3,200 on family members or $6,500 annually caring for children. And these are real world anxieties and costs that the employees are dealing with, in addition to trying to get all of their work done, knowing that despite these caregiving situations, the work still needs to be done. The organization still needs to move forward. But this is just a real world example of what that financial strain and impact are employees who are also caregivers. Next. So again, just looking at this as an example, the cost of MS is thought to be around 4.1 million. And certainly that is an astronomical number of what care individuals are looking at. But I think also the important part of the other 2 bullets here is 43% left the workforce within 3 years with a diagnosis of 20 to 50. That puts a significant impact of people who are leaving the workforce. It also puts a significant impact on what could be the spouse who is now in what could be only a 3-year on-ramp of becoming fully employed, particularly full-time caregiver, perhaps, and the breadwinner of the family. So really looking at how, as employers, we can look at helping our employees, because knowing that whether it's a chronic disease situation, it might be a tragedy, it might be something else, there can be a very short on-ramp between when that caregiving situation comes into their lives and when they need to really be acting as that full caregiver as well as that full employee. So just understanding that sometimes that on-ramp is very short, and how as employers can we support our employees who are now in that situation. Next. So again, looking at some non-financial considerations for employers, looking at creating an inclusive environment, managing attitudes and expectations. We saw previously there was 34% did not disclose, and there was 15% weren't sure. Creating the norms around caregiving situations, about the norms around caregiving benefits, that this is not something different. It is something that it could be really companies can lean into as an employer from top bottom, really creates that more inclusive and collaborative environment. And again, for the care partners, the concern about disclosing and what is that going to do to their career? What is that going to do about their future? Again, we saw more, according to the report, more disclosure in intense care situation, but care situations are care situations, and certainly can have an impact. It's having an impact on their personal life, and absolutely can be having a serious impact on their work life and their productivity. That is really where the employer is concerned and wants to make sure that there is support. Next. So this is kind of really going back again to the greatest sources of stress is the financial and career growth. And AARP also did caregiving out-of-pocket costs and looked at interviewing 2,400 caregivers from all ages and ethnicities, and looked in 30 different categories. What were their costs? If they extrapolated, they looked at the cost over a week, what were those costs? And these are some of the high points from that report. So 78% had an annual out-of-pocket cost. So again, thinking about that 53 million number, so 78% of them had an out-of-pocket cost. More than half of them, the costs were going towards housing expenses. Now, that might be rent, might be mortgage, it might be home accommodations, it might be assisted living, but that's a good portion going to those particular areas. Then the other two, I think, are very, very closely tied. So $1,200 on average yearly, looking at medical expenses and needing to take off 12 hours per month in order to help their care recipients. So certainly, as a more intense care situation might present, more time off is needed. So those areas I think are really critical for employers to understand the strains that our employees are under and what the financial costs are. And certainly not everyone can absorb those financial costs. So according to the report, I thought it was also interesting that some people will get a second job or might very well choose not to retire. So these are concerns that our employees are facing when they are facing now these unexpected requirements of being a caregiver, both in time as well as finances. Next. So I think this slide really puts it into a very visual and stark way. So when we look at it, if we look in terms of saving, so we have 28% stopped saving and 22% have used up personal short-term savings. Looking at debt, 23% are taking on more debt, and 15% have borrowed. So in terms of expenses, you have 19% not paying bills. So if you think about 43% of this group says they have had experienced one financial impact category. The 34% have said that they have more than one. So just imagine the strain on an employee who may now have stopped savings and still has debt, took on more debt and still has unpaid bills. So just imagine that stress that the employee is looking at it when they are dealing with these type of financial strains, and not only one financial strain, but 34%, a third of people of our employees are dealing with two or more concurrent financial strains, and what that can do to them, to their own healthcare costs, their ability to be productive, what they're doing and how they're doing it, and how they're really able to bring their full selves to work. Next. So then we take on and we add COVID. Certainly we've all seen the impact of this in a variety of different ways, and taking all of those concerns that were in existence for employee caregivers prior to the pandemic, and looking at layering on top of it. We've all heard a lot about parents who are having challenges, whether going back to work and schools opening and all of those caregiving activities, as well as dealing with situations where they may be having other individuals who are immunocompromised or another care situation in their homes, and just that added concern that the pandemic really has layered on top. And then looking at not only being the caregiver, but having redundant backup plans. So if the initial caregiver does contract COVID or has some issue, how do you find the backup caregiver and what all of that requires? Does the individual have enough medication? Does the individual have enough food? Who was that secondary caregiver? So not only the primary concern about caregivers, but what is that backup plan? And how do you have a backup plan that needs to be that deep and that concerning? And then also for the caregiver themselves, when restrictions ease, they're still dealing with a situation that very well they may not be able to go in different activities. They may not be able to experience different things because of their caregiving situation and what the risk to their care recipient is at home and what that looks like. So they need to take extra precautions. They may need to look at that. They may need to look at what they need to do. And again, that compounded strain on our employees and how they're able to be an effective caregiver and an effective employee really has been exacerbated and has increased that strain and anxiety. Next. So this should not surprise anyone. Some of the stats: higher depression, higher fatigue, lower financial well-being. All of the employees, I don't think these stats really surprise anyone here. But what I would say is this is important for employers to understand, that we're hearing all about the Great Resignation and what that means for all of our organizations. And people are looking at companies that really come to them with a idea of inclusiveness and what they're going to do and how are they really meeting them where they are. So leaning into caregiver benefits, inclusive environment, and really normalizing the caregiving situation can result in a strategic advantage or strategic business advantage, either retaining good talent, and we all know it's expensive to replace an individual, not only in costs, but in relationships and productivity and all that area of those kind of softer benefits. But also it can be an attractor for good talent when people are looking for organizations that are more inclusive, that are more respectful of what they're looking at, that are really looking at the entire person. So leaning into some of those caregiver benefits as an employer might be really helpful to retain individuals as well as attract good new ones who are interested in really in what that means and how that means to them, and the importance of that the employer is placing on that as well as the employees. So now really is the time for employers to lean into that empathy and that support as a good business decision. So I know John is going to talk to you a little bit more about some great work that they've done and kind of continue on this theme and of how employers really can be part of the solution.
Thank you, Gina, and thank you for that excellent presentation of what caregiving looks like overall in the population and what individual caregivers are facing. Certainly not an easy thing in life. Many of us on this phone, family caregivers, and we know the challenges. But what Gina laid out for us is the perfect segue to what we're going to do now. Because now we're going to shift our lens of looking at this issue and look at it from the perspective of employers. We know many of you on the line are HR folks from your companies or managers and concerned with your employees. And so now we're going to take a look really at, from an employer's perspective, what the caregiving situation is presenting to you as an employer. First of all, we know that family caregivers are very, very concerned, worried about their jobs and about their future careers with their current company. So, if you look at your employees right now, they are more likely, 1.4 times more likely to worry about their future with you as a company than your employees who happen to be non-caregivers. Those family caregivers who are your employees are also, very concerned about the quality of their work. They are not having a lackadaisical approach to this at all. And quite the contrary. If anything, they're even more worried about the quality of their work, twice as likely, in fact, to think that their work quality has lessened because of their caregiving responsibilities. Now, if we look into that, you may see that, in fact, the work quality has not lessened. But what's happening with your employees is they're more worried about it. So that is definitely something that as employers we need to keep in mind. And then what's interesting here is half of those employees with caregiving responsibilities are 50% or more likely to look for a new job if they're required to return to full-time on-site work here after COVID, maybe thankfully, finally begins to wane. This gets a little bit at what Gina was introducing with this notion of the Great Resignation going on throughout the United States and what it means for your employees. So if you're now in a situation where you're going to be bringing your employees back to being on site most days or all days of the week, your employees who are caregivers are 50% more likely to look for a new job. So we bring that up because, the costs of retraining, finding a new employee and retraining a new employee to take that job can be quite serious, as you as employers know. I remember before the COVID pandemic, Kimberly Clark did an estimate for us that to retrain, to recruit a new person and train them for that position, if a family caregiver left that job, equaled about 150% of the annual salary. What that is now post-pandemic would be interesting to see, but it's very costly to replace workers who left the job because of their caregiving responsibilities. So we need to keep that in mind. If we go to the next slide, we want to set this out for you as employers, so how you can address this problem. It'd be very easy for Gina and I just to discuss caregiving in the United States and the problems that presents all of us as society, the problems it presents us as individuals who are family caregivers. But we're really here today to try to help you as employers get your hands out around this problem and what you can do about it. So for you as employers, there are some considerations of caregiving that may sound a bit obvious, but are less obvious when we look at them in detail, which we will in a couple of minutes. First of all, building a culture of disclosure. Gina referenced this a little bit. Still a lot of stigma. So a lot of times your employees are not going to want to disclose the fact that they have significant caregiving responsibilities. Then you as employers trying to figure out what those appropriate and reasonable accommodations are. And I'm going to get to this in a couple of minutes too, because if we talk about this, everybody comes to think, oh, well, they just need more flexible, family and medical leave. They certainly do. Absolutely, they do. But if that's the only thing we're talking about in making accommodations, we've missed the point entirely. Because once they need that more flexible leave, they're already in the crisis situation with caregiving. We want to help you get supports for your employees who are caregivers before they even get to that point, so they may not need to take as much new flexible leave. Driving awareness about any accommodations that you as the company may make. I think you'll see in a couple of minutes how, interestingly, even the best employers of you out there who are making accommodations, guess what? The fact is, we look at the numbers, your employees don't even know that you're doing that. So it leads into managing this expectations on the parts of everybody in the company culture about their attitude toward caregiving and what we can expect, not only from the employees who are caregivers, but what we can expect as employees from you, the employer, in making accommodations. And then this last point, and again, it sounds very obvious, and I'll tell you why it's not so obvious. The gaps that exist in even the basic education for those of you who are HR professionals in the company or the managers. This is a very interesting fact we found. You know, Gina mentioned that 34% of the time, the employer doesn't know about the caregiving situation of the caregiver. You know, that's how they report it. So you look at the obverse of that. The fact is, the majority of the time, simple majority, the employer does know that the caregiving employee has caregiver responsibilities. If they have really significant caregiving responsibilities because it's a real serious situation, the fact is almost 3/4 of the time, the manager knows about it. But, and here's the rub, even though the majority of the time that manager knows that the employer is having significant caregiving responsibilities, more than half the time, the employee does not think of their manager as being supportive. So there's this huge company culture message that we need to get through so that those caregiving employees do feel supported when their manager knows about their caregiving situation, which is the most of the time. If we go on to the next slide, I want to get this into a little bit deeper before then we get to what you guys as employers can actually do to get a handle on this issue. 40% of caregivers, so we're talking about a significant number, feel that their relationship with the company, with their employers, is strained simply because of their caregiving responsibilities. And that's an important point, because as we all know, as HR folks, as managers, you want your employees to feel as comfortable, as confident as they can about you as an employer in that work relationship. Here's interesting that by far the vast majority of employees are not aware of any accommodations that you as a company have put in place, if you're one of the good companies who's already put something in place, to help them as a caregiver. So 71% of them just don't even know that you offer anything, if you offer anything. Then it gets even more interesting than that. So if you're an employee who's a caregiver, right, not just everybody in the company who may not know you do any accommodations, but you're actually a caregiver and your employer offers some accommodations, only 34% of those caregivers are aware of what the company offers for a caregiver. So we got a real communication problem, even if there are accommodations being made. So this is a twofold problem that we're going to stand from the standpoint of the employer. One, some accommodations have to be put in place, and that's more than just flexible leave. We'll talk about it in a second. And then after that, making sure your employees know about it so they can use it. If we go on to the next slide, there is no question that it's difficult for your caregiving employees to have these conversations within the company and do everything else they need to do, right? So typically what's happening with your employee who happens to be a family caregiver is, maybe they're spending a lot of time during the day on the phone arranging for the doctor's visits. Or what's quite common is something has just happened. All of a sudden there's an urgent situation that I have to rush home, or I have to get my mother to the hospital. So even if I'm getting her somewhere, getting someone to get her there, I have to meet her at the emergency room. Those are the things that happen. And it's quite difficult to bring those things up in the workplace to begin with, but they have to. So all of that is taking a tremendous toll on your own employees' mental health, right? We're all concerned about behavioral health issues in the last couple of years. We should be. All right. More than half of caregivers show symptoms of depression. Believe it or not, almost half of them actually meet the clinical definition of depression. And what we saw during the COVID pandemic is that tremendous increase in these numbers. So even at the best of times, depression is quite common among family caregivers, twice as common as it is among non-family caregivers. And if your employee happens to be a woman, a wife caring for her spouse, her husband, who needs caregiving, that wife is 6 times more likely to suffer depression than a non-caregiving wife. So huge, huge, huge issue here. It's an issue not only because they're facing depression, but because if you think about it, that's in many ways going to drive up your own employer provided healthcare costs, because that stress on your employees who are caregivers makes their health suffer, and they have to use the healthcare system more often. So keep that in mind. We're not just talking about a lot of depression and they're depressed, but it drives up healthcare costs. If we move on from there, tonight I want to drill down a little bit how we, can help a little bit. At least we hope we can, in pointing you in the right direction of what this means for your company. So if we go to the next slide, I want to talk about one. Of course, I'm biased a little bit, but I think this is a phenomenal tool, and it's one that Gina's organization and my organization making available to you guys for free. And boy, I hope you'll use this, right? Because somehow you want to figure out what's going on company-wide with your employees, how big the problem is or not, and what those employees think about you as an employer when it comes to caregiving support, and really what they would want, right? We don't want to have you as HR folks and managers in the position of guessing what supports to put in place for your employees. We want to make it easy. So there's this confidential employee survey that you could give to, any or all of your employees in the company. It's about 21 questions. It really gets to the meat of what needs to be done here. There are some questions at the beginning, kind of demographic-y type questions, where you will very, 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 very quickly be able to get the real handle on the prevalence of caregiving among the employees of your organization. Worth knowing exactly how many you're dealing with, who they are, that kind of ages, et cetera. And then understanding what accommodations those caregiving employees would actually like to have. Again, everybody thinks of flexible leave. That's certainly one. But if you go to the this particular survey and see what we're asking them for, you're going to see a menu of a dozen different types of accommodations. And very valuable to have your employees themselves look at that menu of things, figure out what they think would be useful to them as an employee in your company, and then you figure out whether you can make those accommodations or not. And then very importantly, as we said, even if you have accommodations, by far the majority of your employees don't know about it. So that's important here too. And one thing the census gets a handle on is how to see how many people are in fact aware of them and how many are using them. Because when you come right down to it, the fraction ends up being quite small, which defeats the whole purpose of making some accommodations in the first place. So I know I'm going a bit at length here, and I can't go through all 21 questions, but I certainly hope you'll use this in your companies. It gets to questions like asking the employee, is it important to me that my employer is asking me about my role as a caregiver? Or I would be more likely to stay in the job where my needs as a caregiver were met and that my company was talking about it. Gina alluded to this too. This is what employees are looking for nowadays. We think of caregivers and we tend to think, most of these are probably near retirement age anyway. No, that's not the case. The fact is now all of us are called into caregiving. And as Gina mentioned, the majority of caregivers are in the workforce. That's true. The majority of us as family caregivers are like those of us on the phone with full-time jobs trying to juggle work and caregiving. But here, this might surprise you. The majority of caregivers in your company are in their prime career ages of 25 to 54. They're younger than you think. And with younger employees, when we're talking about millennials, this is the type of support. These are the types of benefits that employees want, and you know this better than anybody, in their jobs today. They're not looking for pensions. I don't even know that word. That's 2 generations ago. It's these, what Gina kind of called soft benefits, these lifestyle benefits that's important to employees. If we go on to the next slide. So how do you deal with this, right? So let's say you went through the trouble and you did this employee caregiver census. And then, so what are we going to do about it? Well, there's some things very, very straightforward that you probably think you're doing and you're not doing at all, that can go a long ways toward this. Do we actually use the term family caregiver? Do we talk about that in our HR information? Do we ever mention this term in what's said to employees, whether it's a benefits manual or a policy manual? Do we think about family caregiving as a company the same way we think about maternal and paternal health or leave? Because the situation is awfully similar. And if we haven't made that connection in our minds as employer, it comes through very, very clearly to our employees. Are we looking at those needs Gina mentioned in her slides for those employees, right? Their emotional strain far greater than our other employees, financial strain so much out of pocket. Are managers sensitive to the presence of caregivers in their business unit? And this goes to that point I made just a couple of minutes ago. Fascinating. Most of the time, that direct line manager, that branch chief or whatever who has 10 people, is probably aware, especially if the employee has a significant caregiving situation. But most of those employees don't think of the manager as being supportive. And that's because we as companies haven't told that manager what to say, where to point the employees in the right direction that will make them feel supported. It can be solved pretty easily, but it's got to be solved. Do we work to maintain the notion that caregivers are less committed, right? There can be this notion, it's a mistaken notion, that somehow caregivers, regard their job less seriously than others. You'll not find that demonstrated as true in any survey whatsoever. If anything, they're more concerned about their jobs. And then ultimately, are we as a company willing to make some accommodations? So if we've gone quickly to the next slide. Again, I said, we are here to help you and to make this as straightforward as possible for you. It does us no good if we merely describe the caregiving situation and problem, which is what my organization is all about. But we don't help you as employers, by pointing you in the right direction of what can be done about this. And I think we can make it a lot easier for you as employers than you think. So we wanted to put 4 things here. The first one, of course, is that caregiving census for your employees that we mentioned. The Job Accommodation Network, a good place where both caregivers and employees can ask questions. The wonderful work that Gina's organization does when it comes to the employment side of MS. And I love MS as being an example here because, as Gina so wonderfully pointed out, again, with multiple sclerosis, you're not typically talking about those people who are, towards the end of their career in near retirement, right? Multiple sclerosis is, hitting in your early 30s. So one, the employment impact for that individual who has MS, but also then now for that individual's family caregiver, who's also pretty early in their career. They're in their early 30s. This is not what they signed up for. It's not what they expected. But somehow now they got to work that caregiving situation into their job situation and their career. And, that's why it's very important for us as companies. And I love the MS example, because here's your employee, 29, 30, 33 years old, who now has significant issues, either as a person with MS or someone caring for a loved one with MS, and you don't want to ignore them. And then my organization actually created a Caregiver Action Employee Network, where we have this already, turnkey ready web-based series of supports to put in place for a company's employees so they can be supported. Again, the types of supports you would need even before the employee gets to this crisis point and has to take more flexible time off. So, where can they talk about their problem, vent it? How do they find if they need paid in-home care without taking 8 hours on the phone that day, trying to search for in-home care or a nursing home in Florida when I'm a employee in New Jersey? Easier, more straightforward ways to support caregivers being able to do that, to reduce their stress, to keep them more productive on the job. And these resources, I think, will help you get that much more straightforwardly. Again, I think that was the whole point of us doing this hour, to help point you in the right direction. So with that overview, at least from what you as employers can do, and I'm sure we'll have many questions about it, Neil, I will turn it back over to you.
Great, thank you, John, and great job, Gina. Great job, John. Thank you so much. Again, please type any questions for our speakers into the chat box, and we'll do what we can to address them in the next 15 minutes. So let me ask you, just to start us off while we're looking for some questions from the large audience. Going back to think about COVID, I'm thinking about the fact that many people had to transition to work at home, and many people are still working from home. Has that made caregiving easier or harder, or depending on the situation, has it gone both ways? And what's your advice for employers now who are starting to bring people back to the workspace, where there will be another disruption to the caregiving flow?
I'll start there and let Gina chime in. Remote work kind of cut both ways. It was a double-edged sword. Yes, in some ways, and this is somewhat intuitive, it made it easier for employees who are caregivers, because at least they could be home and not have to rush to home when some crisis occurs with the person they're caring for. So, they could be on the spot. But think about it. In some ways, it was just the opposite. They were remote working, one, because, nobody wanted to spread COVID in the workplace, but also because, most schools were closed. So now you're a caregiver, you're working from home, you have the kids at home because they weren't going to be in the schools, you're caring maybe for an adult loved one, and maybe that elderly loved one is living with you, right? So remote, you would think, makes it easier. But now you have your elderly loved ones in the house with the kids who before vaccinations were notorious COVID carriers. So if anything, it made the challenges even tougher for caregivers in those situations. And if it were a situation where, as it was in the first half of the epidemic, that you couldn't visit your elderly loved ones where they were living, it made things awfully, awfully, awfully tough. So it did cut both ways. Now, as we come back and bring them back from remote, possibly, to full-time on-site, we have a huge transition problem. That one, not only do we return to the challenges that we had before of having to do it, while you're juggling on the job and still having to worry about those crisis points, those pain points that occur. That's why you want those supports in place, so they can be supported in doing that and not have to scramble and take all those hours on the phone once it might be time to put mom in assisted living. Have those supports in place. And thankfully the kids are back in school, so that can be done. But it is a whole shift again to get people back into the office space. And it does present a new challenge for caregivers. And now that they have to go back and figure out, maybe I need someone to watch my loved one during the days where I'm actually on the job in the office. So, we would love to think that the whole remote situation made things easier, and if only we could stay that way, it'd be great. But now this is all cut in every possible way. And the challenges for caregivers simply increased no matter how you looked at it.
I would agree with John's very eloquent overview of that. I think that one of the kind of backing up a little bit as well is that earlier on in the pandemic, you had situations, and I don't want to quote numbers, I don't know, but I mean, I've heard several sources talking about the fact that if you had two spouses, then the woman might be the caregiver and is now backed out of the workforce, has now left the position. So organization has done a lot of work on gender diversity and really engaging the workforce and really working and leaning into that. There have been a number of people a number of couples, when they're looking at kind of a uncertainty of the children going back to school and what that looks like, and dealing with some of those issues, there have been a considerable and a disproportionate amount of women who are now have left the workforce. So when you're going back and you're looking at people going back into a work environment, you are missing a considerable amount of one part of your workforce. And what is that going to do to an employer's diversity initiatives, the voices around the table. So I think that there's, and I agree with John, somebody like MS who might have argued that I can work from home, I can be productive before COVID, and was not met with a pleasant or inclusive way, now has shown 2 years of being able to work from home. So I think for certain ones who are dealing with mobility issues or fatigue issues, absolutely there's some benefits, but I think there's maybe some more unexpected losses that we have on who is the primary caregiver most often and what we're losing.
Thanks, Gina. So picking up a little bit on that, we have a question from Betty Francis at the Delaware Y about going beyond the obvious accommodations of a flex schedule and some additional PTO. Are there other unique accommodations that you've seen that might be offered more broadly? So what else can employers do to be supportive here?
Yeah, let me go to that really specifically. There are some very tiny specific things that you can do, and I'm going to give you one example here in a second, that will send a huge message to your employees and increase their confidence tremendously. And there are some things that go pretty far reaching, but that you can do easily and for very little cost. Let me give you an example, the first. We're still in a situation, probably will be for a long time, where in the office, your employees, are in cubicles or they're all grouped together, right? Not a lot of individual private offices. So a caregiving employee has to make some calls, right? To paid in-home care workers, or doctors, a nursing home, whatever. And they're talking about pretty sensitive stuff. The very idea of just having a little, broom closet kind of room office somewhere where a caregiver can go and make that call for 5 minutes in privacy costs you nothing, easy to do, probably a broom closet you weren't using anyway. Wow, what a huge statement that's made to your employees. On the other end of the scale, putting a lot of supports in place, but frankly can be easy from your standpoint and low cost, kind of what we created for companies to use, the Caregiver Action Employee Network, this whole suite of resources online so that they can call our help desk, or all of a sudden, if they do need to figure out assisted living for mom in Florida while I'm in New Jersey, which could take me, I don't know how many hours of phone calls starting from scratch, to be able to go to that suite of resources online, that wasn't hard at all or costly for the company to put in place. So they know where to look, what questions to ask, the type of help I actually need can be tremendously helpful. So there's a whole slew of things beyond, flexible leave that you can do, that you should do, that are easy, that are straightforward, and I guarantee you are low cost.
Well, kind of piggybacking on what John said, I think that surveying the employees to find out what they want, especially since there seems to be a real disconnect, and we've seen that between the the willingness to disclose and feeling like the manager or the organization is behind them. If you want to know what accommodations your employees are looking for, asking them and then triaging what that looks like is a great way to be responsive, be proactive, show that you are an engaged employer. There's a lot of goodwill and data that you can get out of it that you can make actionable.
And I should say again, I know we've said it, but I don't want anyone to miss it. This exact question is on that employee survey we're making available to all of you for free. So you can actually poll your employees to see which kind of support beyond flexible leave that they would like to have. And even if you didn't have them all fill out the survey, you'll see a menu of a dozen of them right there. That'll give you a pretty good list from which to choose that you can go ahead and do right away, right there in the employee survey for you.
So we've heard oftentimes that there's a big disconnect between what the HR department thinks its culture and policy are and what the frontline managers are actually doing or what they're conveying. And that a lot of times people feel like, I know my company says they'll allow me to do this, but my frontline manager is not very accommodating, or I'm afraid to even raise this. So what advice do you have for how can companies sort of monitor, manage, educate support getting that word out to the management team?
Yeah, there's definitely a huge disconnect. So credit to who's asking this question. I can only answer it from Caregiver Action Network's standpoint as a nonprofit. One thing we built into the Caregiver Action Employee Network is there are resources for that individual employee. There's also resources for the manager. And we wanted to keep the resources for the manager very brief, right? The manager has a real full-time job, right? They don't need to become a caregiving expert. So we have this, I don't know, it's not even 20-minute video for what the manager should say when the employee brings it up. And then how to sound supportive, which is basically, well, send them to these supports, these accommodations that the company's made. If it happens to be the Caregiver Action Employee Network, go to that website. And that's all it takes. Merely being able to, as the manager, be aware of that, know what family caregiving is, you're not reacting badly, and then just know where to point the employee in the right direction. That's a support. It's an easy problem to solve, but let me tell you right now, as the question implied, the disconnect is this big about your employees now feeling in any way supported by their first line manager.
We've actually added in an online platform that allows for a much more robust feedback loop between employees and much more 360 reviews, different conversations where you can add in other reviewers. So what we're looking at doing is creating a culture of feedback, and not only top-down feedback, but much more bottom-up and peer-to-peer feedback. So I think if an organization was interested in investing in, and there's a lot of different platforms out there, but we're really excited to use it for exactly those reasons, because I don't always have visibility of the way my entry-level employees are feeling. So really leaning into the aspect of multi-level feedback is really a way to find out from various levels what's going on, good, bad, or indifferent. And that is something that a company could institute that would give them not only information about how people are feeling about caregiving, but a lot of everything that you would kind of term as culture. And again, give you data that's actionable.
Thanks, Gina. So I'm not seeing other questions from the audience. Let me just ask you then in closing, a key message or takeaway. We've covered a lot of ground. It may be something that you repeat again, but Gina, what would be the one thing you'd like people to take away or act on in follow-up to today's webinar?
I think the fact that an inclusive environment and a normalization of caregiving importance is good for the employee, it is good for the employer, it is a good business move, and it is a good human move.
Yeah, and Gina, let me just add to that, the numbers you showed before, the person who's a caregiver is no longer that minority. I mean, the data you have suggests this is half the workforce, and maybe the message is just, you're not alone. A lot of us are struggling with these issues. Yeah. John?
Let me say this as bluntly as I can. We ignore this at our own peril as companies. As Neil and Gina were just getting at, family caregivers are everywhere. They're all your employees. We're as common as people with brown eyes. You can't ignore everybody with brown eyes as part of your talent pool. So we ignore this as companies at our own peril. And my message to you is, and it's easier and more straightforward to get a handle on than you think. And we're here to help.
Great, thank you. Well, thanks again, Gina and John. We appreciate all the great work being done by Caregiver Action Network and the MSAA. You are all welcome to follow up with our speakers. We'll also make the recording available. Check out the resources that were mentioned, including the MS Workspace resource. Thanks again to BMS and to Spark Healthcare. And thank you to all of you for sticking it out through the hour. Have a great week.
Thank you so much.
Thank you.